It's 10:31. We've got 173 in. We should have close to 200 for this session. They'll be joining us shortly. So I'd like to thank Jennifer Roselli for doing this presentation for us. Very timely presentation. All the fun we're having trying to get our people to come back to work, and you know, all the things that have been provided for our employees to allow them to not work. So it's been a struggle for us, and this should be some great information for us. So Jennifer Roselli from Genova Burns, thank you.
Morning, everybody. I don't see you, but I'm hoping you can see me. I am in my office in Newark today. It has been a strange transition back to kind of whatever normal today is. So what we're going to do a little bit today is talk about, how we're going to plan going forward. Technologically, please be mindful that I'm not a guru, but I do understand that there is a way for you to submit questions. We will handle them. I understand that halfway through is a poll. Oh, I see something popping up already. Oh, good. You can see me. Thank you. So what I'm going to get is little notices. I will try and take them in real time if I can, but we'll make sure that there is some time at the end to get through some of the questions, and you'll have my contact information as well. So I have to tell you this, you should not interpret this as legal advice. We are talking in the context of COVID for the most part, but we're going to talk about a bunch of different things today. So first thing, we're going to start out with safety generally. This is not meant to be an instruction on how to keep your employees safe in terms of CDC and all of that. It's more to highlight the negotiability, the cost, the things that you as employers are going to need to think about. We are also going to go through the new leave entitlements. FMLA existed, New Jersey leave existed, but those have all been expanded, changed, adjusted, and give employees a significant amount of additional rights. We also have breaking news. I just want to put it on everybody's radar. There's some new legislation about local borrowing under bonding that everyone should be aware of. It's not really going to tie into, I think, for most of this discussion, but it's something that should be on all your radars. And then we're going to look into planning forward and how to move forward. And we're going to get into the horrible area of how do I cut my staff. We're going to talk about layoffs. We're going to talk about civil service layoffs. We're going to talk about furloughs. And then we'll wrap it up with some practical considerations, some policies you may want to consider. We're going to do a lot of this under the umbrella of cost factors. We're going to do a lot of this under the umbrella of collective bargaining. I was asked to give particular attention to the civil service side of things, so we will spend a good portion of today on that. But just know that there are a lot of moving pieces, a lot of overlaps. I will try to fill in some of those gaps where I can. But each employee who comes to you with their own reasons needs to be addressed on a case-by-case basis. So kind of within that world, let's at least talk about returning to your workplace, right? You're all back. So you want to be thinking about determining exposure points. You want contingency plans. If I get sick, who's taking my cases? Basic infection prevention measures. We'll talk about some of that in the next slides. Policies and procedures for your sick employees. When do you send somebody home? When do you say to somebody, don't even think about coming in? Who pays for it? Whose call is that? Those are all the things that we're kind of grappling with on a day-to-day basis. As we move into cold and flu season, how strict are we going to be about the sniffles keeping you home? Do we have to be that strict? And this is all going to change based on the evolution of this pandemic. You'll hear me say it a little later too, but the EEOC is giving employers a lot of leeway right now because of the nature of this illness. There's a lot of unknowns. There's a lot going on that allows us to ask a little more than we normally could, but that is absolutely going to change as this evolves, as we learn more, as there are treatments and vaccines. So what we're allowed to do at this exact moment in time is something we're going to have to think about going forward and watching as this changes. I can tell you in March, in April, when the pandemic hit the hardest and we shut everything down in the state of New Jersey and the state and federal laws were changing, it was a day-by-day change. I don't think we're going to see quite as rapid fire, but I think we're going to see a gradual return to pre-corona times, at least as far as employee health, employee disclosures, and things like that. We're going to also need to consider, as All of this is evolving. Workplace flexibilities, we'll talk about that here and there throughout this presentation, and having some workplace controls. Safety is paramount. As employers, you have to give a safe working environment. You'll hear me say this a couple times today, but health and safety is negotiable. You know, negotiating what kind of masks, who pays for those masks. That's all things that we need to be thinking about, particularly you as your budget development process is happening, as you're evaluating the loss of revenues or taxes that's are coming in, or any of the hardships that Corona has happened for a financial perspective. There are some significant increases in costs that go hand in hand with all of this. So let's just talk a little bit about the preventative measures, because those do have all of those costs. You know, social distancing. You see, I'm sitting in an office. I have a door, I can close it. You notice I'm not wearing a mask. There's nobody around me. But when you sit in cubes like they do out in the hall, do you need to put up the dividers? Do you have to make people wear those masks? How much does that cost? Having soap, you know, we tell everybody wash your hands 20 seconds while you sing happy birthday to yourself, but that's expensive. Hand sanitizer at 60% alcohol, incredibly expensive. The routine disinfections, using the EPA registered disinfectants, those are costs that maybe you haven't already absorbed or you need to continue. And of course, you need to have your mouth covered and your nose covered and face coverings and respiratory etiquette. You know, they teach kids now to sneeze into the elbow, and that's really become our norm. And in that context, you've got this reopening concept, right? You need to consider your telework possibilities. There are still limits on how many people may be in a room. There are still limits on total building occupancy. Flexible schedules, having shifts that come in, having shifts that don't come in, having limits to people in your break rooms or your lunch rooms, making sure you always have soap. It's amazing how much you notice that the soap dispenser is now empty. Or that nobody ever realized that the soap dispenser is empty. And again, sometimes it means break time during the day. All of this has a cost. All of this has a negotiability impact. So all of this becomes part of the balancing act as we plan our personnel. How you put your signage up, how you demarcate where people can and can't go, one way, how do you seat people? There is a true economic factor here that we need to be completely cognizant of. And then there's more. You have your protocols, you have your reporting structures, you have to do training. Believe it or not, I recently got asked to do a training on how to appropriately wear the face mask, the same one that we've been wearing to go grocery shopping and all of that. So people are asking questions, people are concerned. Management needs to be trained. What you can ask, what you can't ask, what you should be doing, how you tell somebody to stay home if they're not feeling well. How do you tell them, sorry, that's your sick day versus, oh, wait, you have this entitlement, and figuring all of that out. You know, isolation, once somebody comes in, I come into work today, I feel fine, then all of a sudden I feel like I have a fever. How are they going to remove me safely so I don't infect everybody else? Temperature screenings. That is a very, very, very complicated fact. We're not going to get into all of that today, but be mindful that there are significant privacy considerations that need to be taken into account. EEOC is allowing the temperature screenings. I don't know if any of y'all have been to a doctor's office or maybe even your barber. You walk in the door and you get zapped on the forehead immediately. But in the workplace, there are certain things and certain protective steps that need to happen, and privacy expectations. You can't have a line at the door where I get to hear what my colleague's temperature is. So bear that in mind. Sharing. We can't share anymore. No desks, no offices, no phones. People are very uncomfortable with that. It's not recommended, but that has an increased cost. So within that, we want to think about your practical notes. Your health and safety requirements are yours. You as the employers must have that safe, healthy workplace. You know, the face coverings at no cost may be something that you need to consider. We've seen certain workplaces that are unionized say, you know what, we'll give them. We've seen certain ones say, sorry, you've been wearing them for the last 6 months. It's your cost. But that becomes something that's a negotiable subject. We've also seen employers say, you know what, I'm going to provide it so that everybody is uniform. That happens more, I think, in the school districts where, you know, uniform standards and making sure that everybody kind of blends in and doesn't distract is important. But we've also seen it in police departments, Do you want political statements on your masks? Do you want Victoria's Secret showing up on the masks? Those are the things that everyone is balancing and being mindful that you can't curb certain types of free speech on those masks. So just keep that in the back of your mind. And of course, we all know that face coverings aren't just the end and be all. You have to still socially distance. You can avoid your absenteeism that way, hopefully. But you also want to be thinking about how you have the prevention of violation of the workplace policies. Everyone should know what the expectations are the minute they come back in the door. I appreciate that's really easy for me to say, but everything is evolving and the employees need to be updated of what those expectations are. There can be consequences to somebody who doesn't want to follow the rules, but you have to take into consideration, am I wearing a mask or not wearing a mask because that's my personal belief? Or do I have asthma? Do I have COPD? Am I medically incapable of wearing that mask? And how do you find that balance in between? So let's talk a little bit first about your staffing, because I think this is kind of the broad picture right now. We have a lot of folks who are scared to come back to work. We have a lot of folks with underlying conditions. We have a lot of folks who maybe were in a state that is high risk or maybe want to travel. So we've got a lot of things that we need to be taking into account. So the first thing is the federal government. Federal government put some laws in place back in the end of, I believe it was the end of March, beginning of April, that created, first and foremost, an emergency paid sick leave. It is at the employer's expense. We'll talk about those details. They expanded the FMLA, right, for certain reasons, but it also still attaches to somebody who has a serious health condition and is under treatment and meets all of those standards, or is taking care of somebody in their family for those things. So mom is sick with cancer, you still get your FMLA entitlements and considerations. Same with the New Jersey family leave. There have been some expansions. There are some new allowances that are COVID related, although I think some of those are being clawed back just because everything is starting to reopen. And then you also have to consider the fact that there are leave balances that everybody has available. We all have vacation time. We all have sick time. We all have personal days. And how are we going to use that time concurrently, independently? And then the big question is teleworking, right? So everybody's been successfully working from home, or more or less successfully, or not at all. How do you tell somebody who has been working from home for 6 months, hitting benchmarks, making sure they're productive, that sorry, we can't accommodate you now because of your disability by letting you continue to work home? So we've created this kind of perception and assumption that everybody, for the most part, can work from home, but it turns on your nature of your position. Fear of return by itself probably won't get you an entitlement to an accommodation. But for somebody who has that health condition, for somebody whose doctor is certifying they can't be back in the office, that's a real consideration that needs to happen. And how do you balance their entitlement to that accommodation and your workplace needs to be looked at on a case-by-case basis. So talking a little bit about what the federal government has done. Right now, this Family First Corona Response Act, it's FFCRA, is in place until the end of 2020. You absolutely positively must have a policy about this. They were supposed to be put in place, I think, back in April. There are also posters that are very easily available from the federal DOL that explain the rights for employees. Those need to be posted in the obvious places, same places you would put all of your other notices. And what this law did was two different components. One is the Emergency Paid Sick Leave Act, and one is the Emergency Paid Family Leave provisions. So let's take that piece by piece. The paid sick leave is you as a public employer are covered. There's no questions. It's not about size. It's just public employers are covered unless you're the federal government listening in. And then there's some exceptions. So public employers, you must give up to 80 hours of sick leave. It's the equivalent of 10 days to an employee who cannot work or telework. And that's the key point we're going to talk about for any of the reasons that are up on the screen. I'm being quarantined. My doctor said, please self-quarantine because you have this underlying condition. I feel sick and I'm trying to get a diagnosis. I'm caring for somebody who's been quarantined or isolated, my kid. my husband, whomever it is, my kid's school or place of care has been closed for a COVID related reason. Now, keep number 5 in the back of your mind because that's going to become a bigger issue today. And then number 6 is kind of their catch all, anybody who's substantially similar conditions. And you can see that this is paid based on the reasoning. If I'm out for my own reason because I'm sick, I get 100% paid sick rate. It is capped at $511 a day and capped at $51.10 for the 10-day period. You prorate that for your part-time employees based on their hours. And if your full-time employee is a 35-hour week, you do it prorated based on that. It doesn't give them more full-time sick benefits than their full-time hours. And then there are some special calculations that go into effect for individuals who either have weird schedules that you can't tie down, but as a general rule, it tracks their hours. And then reasons 4 and 6 here have a $200 a day, 2/3 paid sick rate. So if I'm caring for somebody else, it's to a max of $2,000 total during that same time period. This is your emergency paid sick leave. This is a benefit above and beyond that which is included by statute, by collective bargaining agreement, by handbook, whatever it is. And this is at the employer's cost. One of the big differences here as a public employer versus a small private employer under 500 is under 500 gets a tax credit for taking some of this. They have not extended that quite as directly for the public employers. There are documentation requirements that you can ask for, but you have to be kind of mindful of the fact that when everybody's school, for example, in March closed down, you weren't going to really be getting a whole lot of documentation to prove that, you know, the Bernards Township High School was closed or the Morristown High School was closed because everybody knew it. So there are, like I said, there are ways to get the documentation, but you should also be very mindful that especially on the childcare ones, it's not a significant amount of paperwork that you can ask for. So if we're doing this paid sick leave, remember that teleworking is usually, under this law at least, the employer's decision to make. I decide if you can or can't work from home. Now you see my note here is to proceed with caution. Again, we've had folks working from home probably for the last 3 to 6 months, right? We've pretty much continued operations during this time. We've seen all sorts of different things that have arisen over this time. So how do you tell somebody who isn't maybe your tax collector, but maybe is your assistant who's been doing all this work from home, sorry, you can't telework? And then the other piece of it is if you are letting them telework, you are getting something for the pay that they are receiving. I also would make the argument that this is probably, at least for you non-civil service individuals, I would make the argument this is more negotiable than not, to have the conversations about being able to telework, the conditions and things like that. Now, under the paid sick leave, you may exempt first responders from entitlement, but the word there that is key is may. Remember, in the state of New Jersey, leaves are negotiable. So one of the things that you need to be careful about is when you tell your police department or you tell your fire department, hey, sorry, we're not expanding this to you. The next response is going to be, well, great, we're going to negotiate a parallel benefit. I can tell you in many, many instances, there were kind of overlaps. In some places, from go, anybody who was diagnosed with COVID or was quarantining, the employer assumed the cost of the time off. So we didn't run into it. In other places, we negotiated a parallel benefit. We didn't call it federal emergency sick leave. Our policy specifically said we're exempting the first responders, but then gave, a 10-day window that mimicked this at the employer's expense. So it is going to be I think it's going to be negotiable the way that Jersey EERA is structured. But it's something to, again, proceed with caution when you're telling folks, hey, you're exempted from this, particularly now if the policy hasn't already been announced. Remember that your FMLA rights may overlap. If I have COVID and I'm in the hospital, I probably have FMLA job protected leave on top of this 10 days where I'm being paid, and there may be some overlap, or maybe not for the first few days, but then I become ill enough that I have a serious health condition. So just remember there's going to be some overlap. Same thing with the ADA. There may be some overlap where you have to consider what's going to happen on return. And then the big piece of this is that you may not require employees to use their leave banks in advance of this. This is the 10 days that you get right off the bat. You cannot force vacation time, sick time, personal time, comp time in advance. If the employee asks or the employee asks to supplement or something like that, I think there's probably some room to have that conversation. But as a general rule, this is a 10-day benefit that is an entitlement first, to be followed by whatever else is in the leave banks. And again, that's very expensive. It is an unexpected cost, potentially, because every employee in theory could qualify. So, excuse me 1 second. Okay, so we also have on the back end of that, we have the expanded FMLA rights. You heard me say that you still get FMLA for, your own illness, to care for a sick family member, subject to all of the FMLA guides. Usually that's unpaid leave subject to your employer policy. Some places let you run it concurrent with sick time, other places don't. Just be mindful of that overlap. But what the expanded FMLA does at least now through the end of the year, that may change. It is a paid leave entitlement for childcare purposes. So unlike all the other reasons that you have, the employee only has to be employed for 30 days to qualify. So I'm a brand new employee, my kid's school closes, I've been here for 45 days, and I now qualify potentially for this expanded childcare leave with pay. It's 2/3 of my pay, capped at $200 a day for a max of the 12 weeks, because my child's school is closed or the child daycare is closed. Now, the catch to that is the same as the sick leave. The employee has to be unable to work or telework. And this is where things get tricky. Mom says, I'm home with my 5-year-old who's in kindergarten. I can't possibly telework when I'm trying to teach my child kindergarten through a Zoom session. Dad says, I opted out of sending my child back to school. It's open, but I'm not comfortable. I want this leave. And you're gonna have different reactions and different responses to those two questions. The first one is the kid's not allowed in school, and that triggers these rights. But we're seeing a little bit more guidance come out from the DOL that says if you, mom and dad, or grandma and grandpa, or whomever, says, I don't want my child attending school, then this will not trigger. And then we have to figure out, how do you allow this employee to either work remotely? Do we make them come in on an alternative schedule? How do we handle this balance? So with that context, we're seeing this expansion of leave, again, only through the end of this year. As of this moment, we don't know exactly where it's going to go after that. And I have been told to please pause for the poll question. So I will do that.
There's also a question in the QEA if you want to take a look at that.
There's a new question. Can I require the employee to use leave time for school closing prior to allowing the 2/3 pay? So I guess the typical lawyer answer here is going to be, that's depending. So if I'm not sending my kid back because I choose to keep my child home, the answer is yes, leave time is going to dictate. If I am asking my child to, if I am not allowed to return my child, there's a hybrid schedule, the school is totally closed, on the days that my kid is not allowed to actually go back, that is going to be on the expanded FMLA rights, and you do have to offer that as the first. And what that does is you have the sick leave and the FMLA, and they kind of run concurrent and with each other. I hope that helps. I think I see a new question. Does the employee get 10 days first and then the 12 weeks afterwards? No, the way it's supposed to stack is that for the expanded childcare, the first 2 weeks are unpaid and you backfill it with the emergency sick leave. I think that takes care of the questions. Okay, so I see the time is going, so I do want to advance. Just be mindful of the fact that New Jersey FLA family leave also expanded, but remember it's only applicable when the school or place of care closed by a public health official, and it's because of the epidemic. Again, most of our schools are open, so some of this is going to trigger when the child cannot come in. But it's not really the public health officials right now who are closing the school districts, it's the school districts. The governor's order was that schools could open. So just, again, it has to be evaluated on a case-by-case basis. But if for some reason the schools end up closed again, there is an entitlement to it on an intermittent basis. You may not deny somebody if they qualify and it's an epidemic related reason. Sometimes you can deny based on the job status or how high up in the org chart they are, but not here. This one does not have an exemption for first responders. Unlike the federal law where you have to be unable to work or telework, or be able to show that the child can't be left alone, this is much broader. But just be mindful of the fact that you cannot mandate use of paid time during this because the FLA changed about, maybe almost 2 years now, to not allow an employer to require it. So you do need to also be giving employees notice of their family leave insurance rights, which is that supplemental benefit. Again, I highlighted it earlier. You should be aware of this. It's just something to have in the back of your mind. We have A3971, which had some limited COVID-related bonding options. There's some 10-year payments. There's some differences from normal bonding. You can't get duplicative relief, and you must look to state federal funds first before you go out for bonding. There's some resolution requirements, but just keep in the back of your minds that there is this bonding option. Now let's get to the real meat and potatoes. And for those of you who answered the question correctly, you were right. We are going to talk a little bit about layoffs and furloughs. So here's the thing. If you're not in a union and you're not civil service, your handbook is going to control. It is not uncommon to see last in, first out, recall rights, and things like that. For your union settings, the decision to implement a layoff is a managerial prerogative. That decision, as of right now, is not subject to negotiations. There's some there's some discussion in the schools. There was some legislation pending about that on the school side of things. But at this moment, you as public sector government employers have the right to make that decision. However, those procedures that relate to it become negotiable. That layoff and recall right becomes negotiable. So if you have a union and you have something negotiated, that contract is going to control, with the caveat that if you are a civil service jurisdiction, you must comply with civil service layoff procedures. So you'll see my note at the end of this to very, very much proceed with caution, because what happens is we recognize that we need to cut staff, but we forget about the recall rights. We forget about the fact that this needs to be done for legitimate reasons, and the concern of pretext comes up very often. You know, oh, all of a sudden you need to cut one head and it's the person everybody hates. And then again, of course, the long range planning, because when you've got a recall list hanging around for 2 years and all your positions are being recreated a year from now, you're not going out to the general public, you're bringing back your former employees, subject to whatever you've negotiated. So on the civil service side of things, you have to consider first your alternatives to layoffs. You have to have some pre-layoff actions. There's a plan, it's reviewed by civil service. You have to provide notice. You have to consider seniority. You have lateral and demotional rights, and there are absolute appeal rights. So your alternatives, well, what can I do? Leaves of absence, voluntary furloughs, letting employees voluntarily reduce their working hours, demotions voluntarily, and then any other appropriate action that you could have. Employee participation in layoff alternatives becomes voluntary. We don't get to force that, so we can't voluntarily mandate a furlough. It doesn't work that way. But if they do have a volunteer, they get the same seniority, the original title. It's like none of this ever happened. So prior to doing this, you do have to do a notice to the chair of the commission. You need to have the options for those alternatives. The rights will be restored, a summary of status and salary at the conclusion of all of this. Commission wants to know what you're doing, and they want all of the details. If you're going to do a voluntary furlough, there are planning requirements. I think they actually changed this relatively recently. So you do just want to make sure that you're notifying civil service. You're doing, and then it's voluntary, right? So the employees get to say, yes, I'm going to take advantage of this. They submit a furlough request in writing, the length, and if they want to do shorter work days, intermittent days off, if they want consecutive days off. Being mindful for voluntary furloughs, there may be an impact on an employee's ability to get unemployment because it is considered voluntary. We've seen this become an option in a lot of places, and we'll talk about the not so voluntary furloughs a little later. Some of the other prior to layoffs, you do have some other things that you need to do. You can't hire and you can't promote. You can't claim I'm poor and simultaneously bring on 15 new people. You have to separate your non-permanents first. They go first. You can take provisionals and put them back in their permanent titles. You can reassign. You might try and do transfers and other employment. You put people into positions that are reclassified and abolished, and consulting with your union reps before you do any of this. That's key. These are not things that you can do without having discussions with your local unions. And then, we have a notice of layoff. We weren't able to do the alternatives. 30 days before doing it, you have to go to the commission, why you're doing it, when it's going to happen, copies of the notices, how many people, what you're doing, and what you're going to be vacancies that you can do to fill and things like that. So you do have a very detailed plan that needs to go to the commission. You have to explain that you've looked at all the alternatives and why they don't work. You absolutely must make the representation that you've talked to your union about those alternatives, that you've talked to them about all of this. The affected representatives have to be included in the units that they're talking about. And then the chair can always come back to you and say, we want more. We want more information. You need to tell us more of what your plan is. And you take it from there. And they can also tell you to make changes to your notices. So then you give your notice. It's got to go out 45 days before the actual layoff. It tells the employee when it's going to happen and why. If your notice has been out there for 120 days and there's no extension granted, you do have to serve at least 45 days again. And then once the notice is given, you then go to civil service and say, these are the folks who are going to be affected. So civil service is involved with you every step of the way on this. For you that are civil service jurisdictions, you can't wake up tomorrow and be like, okay, we're doing a mass layoff. There really is a planning and a long process that goes into this. Unlike for the non-civil service, you have probably negotiated some notice periods, but probably not as significant. Permanent employees go in inverse order of seniority. For your non-civil service, you've probably negotiated something similar anyway. There are special rules for police and fire. You get seniority regardless of your title. It's continuous permanent service. And seniority does become part of your calendar years, months, and days, regardless of what your work week, work year, part-time status is. I believe they will back out certain periods of unpaid leave and suspensions. So periods that don't get deducted become your furloughs, your leaves with pay, your military leaves, leaves to fill elective office. But again, suspensions, other leaves without pay, and other layoff periods do back out of that. There's a whole list of things that will be your tiebreaker. We're going to skip past that in the interest of time. Remember that you should be looking at lateral and demotional rights. So in the locals, permanent employees effective have the right to, it's basically bumping. You go lateral, you go demoting. If the position's there and vacant and willing to fill, you can slide on in. You can bump out the provisional. And if there are multiple similar folks, you look at the seniority and the permanency. Okay. Permanent employees who are affected by the layoff can also look in They have working test periods by the least seniority, the position held by a permanent employee who has a performance rating of unsatisfactory for less than 12 months, and a position held by a permanent with the least seniority. So there are a lot of options here for folks who have lateral and demotional rights. So it becomes a moving chessboard, and a lot of moving around as we go into this. And of course, there are appeal rights. It's based on a lack of good faith, that it wasn't really for economy, efficiency, or related reasons. It goes through the Civil Service Commission. You heard me say it before with the proceed with caution. Make sure that no one's going to turn around and say, well, you only targeted this group, you only targeted people over 40, you targeted the minorities, you targeted moms. You have to be very careful about how all of that works, because that will undermine the good faith nature of this. Again, in the civil service context, laid off employees get put on a special reemployment list. You'll see that in the non-civil service jurisdictions. It's just a plain old recall list. It will be something that has been negotiated. You'll have a special reemployment list. It's the title. You get priority for filling those positions if you're on that list. Again, you heard me say it before. If you have a recall list, you're not going out to the general public to fill those positions. You're coming there first. Your ranking is seniority at the time of the layoff, and you can be on, at least in the civil service world, for an unlimited duration. On the non-civil service world, you can negotiate limits. Usually you see about a year, maybe 2. Totally different from the layoffs, though, is a furlough. So that is a negotiable subject. Put aside the civil service consideration of the voluntary furloughs. These are the, sorry, Jen, we don't have the work for you, so we're going to put you on furlough type things. Under the EERA, you must negotiate this. It's not just the provisions, but actually the decision itself. And if you cannot reach an agreement with your local, your option is to lay off. Subject to your bargaining agreement or civil service regulations. What we see is folks try and do the furlough for 5 days, 10 days, 15 days, whatever it is, to avoid the layoffs in general. And some locals are willing to do it, some are not, and it is something that becomes the product of cooperation at the table. If you're going to do it through the voluntary program, you do have to go through the Civil Service Commission again. I think they've changed that 30 days prior to implementation. I will have to check that, and I will shoot that around. I'm going to skip through some of the civil service, but usually during the furlough period for your non-civil service, you do not typically use your vacation balances, your sick balances. The caveat I will give you there is that under the New Jersey Paid Sick Leave Act and the DOL's application of that, so if you have any folks who cover those situations, there may be times that the furloughed individual can still use his New Jersey Paid Sick Leave Act time. But again, as a general rule, you preserve benefits. You do not allow use of time during the furlough, which kind of makes sense because the whole point of that furlough is to try and save some money. So if you're giving them paid leave, it doesn't really get you to that savings that you're trying to achieve. Now, I will tell you, the courts have looked at these. We've got a couple of cases about the unilateral implementation of temporary layoffs. Keyport was the lead case on this, but the thing about Keyport that was incredibly important to recall on this one is that there was a regulation put in place for procedures to do temporary layoffs. So it became a management prerogative, it became an issue, and the municipalities who were civil service had the managerial prerogative to do those furloughs during this 2007 economic crisis. So they typically become negotiable, and since then, they have become negotiable because a couple years later in 2016, they revisited the concept of Keyport. And this was the Robbinsville Township Board of Ed. They were a non-civil service Board of Ed. And what they did was they did temporary layoffs for economic reasons, relying on the court's decision in Keyport, and said, I've got an economic crisis here. I don't have a choice. And the court said, here's the problem. There was a reg that allowed Keyport to happen. We don't have that today. At that moment, right now, we don't have a reg or any other expression of policy saying do these as a non-negotiable resolution. If we see one of those come down, and I have not yet, that could change what I'm telling you today. But as a general rule, in the back of your mind, non-voluntary furloughs, you should expect to sit down and talk to your unions about that ahead of time. So again, normally, Sick leave, time off benefits don't continue during that furlough. Again, for your employees who may get the paid sick leave law, and it shouldn't be that many of them, you should allow them to use it. So if I get COVID when I'm furloughed as a New Jersey paid sick leave person, I probably have rights to do it. And then just remember, out there also is the availability of what they call a shared work program. It's not quite a layoff, it's not quite a furlough, it's actually a statutory program that allows you to reduce time to employees' work schedules. It is through cooperation with the Department of Labor and your union. You have to fill out an application, you have to explain everything. It is a process that needs to be approved, but it does exist, and it's something that you should be aware of because it can give your employees a better benefit in terms of unemployment or less financial impact. And then just some practical things to be thinking about as we come back. Again, your policies are going to be key on some of this. You'll see the list there about all of the variety of policies that we're seeing come back. These are just some things, I know it's not really related to the layoffs and all of that, but you do need to be thinking about all of this stuff. What's the leave policy going to look like? How is that going to impact your staffing? What is your virtual policy going to look like? How is that going to work? A return to work, how do you stop the spread, your safety screenings, things like that. So we do want to be very careful as we proceed. Okay, so I'm going to stop here. I'm just going to give you my contact information on that. I do see some questions coming through, so I am going to switch over. Just give me a second to read. As a non-civil service union member and a part-time employee, what are their rights and what notice needs to be given? And can a PT part-timer be deemed essential and exempt to layoffs? So to answer those questions, it depends, right? If I am a union member, am I covered by the collective bargaining agreement? Does that bargaining agreement address the status for part-timers? My best guess is your part-timers will probably not have the same rights. My experience has been that most of the time it only talks about the rights for the full-timers, especially when it comes to recall and those types of rights. The notice for a layoff becomes a question of negotiability in a non-civil service union employer status. So your collective bargaining agreement is what will drive that. 30 days is typical. 30 days pay in lieu of notice is not uncommon. Maybe you see 40 to 60. Usually you don't see a lot further than that though, because it does tie your hands to accomplish the needs that you need. And then the question is, can a part-timer be deemed essential and exempt from layoffs? I think that's going to really depend on what is the bigger picture. I don't know that a part-time could trump a full-timer. It'll depend on what's in your handbook or your policy or your collective bargaining agreement. But if you're deeming somebody's category of work as an essential employee, you're probably not going to target that particular unit for layoffs to begin with. You'll probably find somewhere else. Let's see. Can statutory employees such as the CFO, clerk, tax collector, and assessor be furloughed? Can certain employees not be furloughed? So I think that's going to be a case-by-case assessment. I'm not certain that they can't be furloughed for a day here, a day there. I'll be honest, I've never actually looked at that question. Obviously, you're probably not going to want to take out the individuals who are key to operations. I have seen police and fire furloughs. It is not common. I have seen furloughs for health individuals, again, not common, especially now, because if you've got your health department furloughed, you have to replace those people. If your nurses are furloughed, you have to replace them. So that actually becomes more of a cost-benefit analysis. The next question is, with layoffs, does seniority matter? It might. And it might only if you're civil service, absolutely, because that's going to be controlling. If you're in a non-civil service jurisdiction, it's a possible, depending on what you've negotiated. And with bumping in a civil service, level of skill probably won't have the greatest of bearing. Let's see another one coming in. If the employees are furloughed once a week, do I know how that affects payroll deductions that are based on their salaries, pensions, medical? Would full salaries still be reported for pension? I believe there was legislation recently that updated the ability to report pensions. Um, I want to say that it happened at the end of June, and how you would report that becomes at the end of June. You would still take your medical deductions and your pension deductions out during all of that, assuming that the individual could pay for it from whatever's left in their balances. And then there's a comment, but I don't think that's actually one directed at me. I think we have about
I'll field that. There's a request for local government services to do a local finance notice on this subject matter. We will ask them, but they generally do not have the expertise in this area, but they can certainly go down the street and talk to civil service. So we will make that request.
I had somebody asking if an employee fares better with unemployment if the furlough is twice a week or a week at a time. Like the typical lawyer answer, that's going to depend. And I say that a little bit tongue in cheek, but the reason for that is you can sort of kind of guess where an employee's unemployment is going to come in, subject to if they have an outside job and things like that. And it also will depend on their income level, because what DOL does is uses this calculation based on a percentage of this times that minus this, and comes up with what the weekly rate and how the unemployment benefits come in. Typically, the lower paid individuals do better if it's a week at a time, and the more highly paid, the less the impact is to somebody, although it's still going to hurt no matter which way you do it. But that will be a salary-based decision and a case-by-case assessment from the DOL. And we should be seeing some additional unemployment come New Jersey's way. I'm not sure exactly when that federal benefit is coming, but I do know that I believe the state accepted it. I think it's what, $300 a week. So we should be seeing that come in. I think I have 3 minutes, which might be enough if anyone has one last question. Hearing none. If anyone's shy, that's my email address.
All right. I thank you once again. Awesome presentation, as you always do. Very informative, very timely. We appreciate your time. I also want to, before we sign off, acknowledge for speakers with the PowerPoint are the best. But when you have a speaker without a PowerPoint, we have that separate screen that show our premier sponsors. I just want to give a shout out to those premier sponsors, since they've obviously, there we go. There's the, at least in the small corner there. But give a shout out to our sponsors. And once again, thank Jennifer for a great presentation.
Thanks for having me.
Go ahead.
I said, thank you for having me.
Okay. All right, we're done. Done another one. See everybody at 11:30.
Bye, everyone.
Bye.